Today our topic of discussion is fowl cholera. Outlines of this video are: definition, etiology, transmission, pathogenesis, clinical signs, postmortem findings, diagnosis, differential diagnosis, control, vaccination. First, what is definition of fowl cholera? Fowl cholera is a highly contagious septicemic disease of chickens that are above 4 months age and turkeys, acute or chronic. Characterized by respiratory distress, discharge from the mouth, diarrhea, swollen comb and wattles, high morbidity and mortality. What is etiology of fowl cholera? Pasteurella multocida. Characteristics: gram-negative. Occurs singly or occasionally in pairs or short chains. Non-motile, non-spore forming. 16 serotypes. Easily destroyed by ordinary disinfectants, sunlight, drying, or heat. What is the main sources of infection of fowl cholera? Infection occurs through body excreta of diseased birds that contaminate soil, water, feed, etc., carcasses of birds that have died of the disease. Contaminated water supplies such as surface tanks, ponds, lakes, and streams. Mechanical transmission by contaminated shoes or equipment. What is the transmission of fowl cholera? Within a flock. Contaminated soil, feed, and water. Cannibalism can disseminate the disease when healthy chicks peck at dead birds. Between flocks. Direct contact with sick or recovered birds or their excretion. Rats, predators and insects. Vertical transmission does not occur. What is the pathogenesis of fowl cholera? Recovered flocks act as carriers for susceptible routes of infection: oral, nasal, conjunctival or wounds. Colonize in nasal clefts. Increase in number up to 24 hours. Reach lungs via air or blood or septicemia. Hematogenous spread to other organs. Course depends upon the virulence of the organism and susceptibility of the host. Death occurs in 16 to 48 hours of infection in acute cases due to dehydration. What are the clinical signs of fowl cholera? Paracute fowl cholera, death without any symptoms. Acute fowl cholera, hunched up position. Fetid diarrhea. Respiratory distress. Cyanosis mostly in unfeathered areas of head. Mucus discharge from mouth. Birds may die within 2 hours of exposure. Mortality 10 to 50%, may reach 70% within 8 days. Chronic fowl cholera. Chronic fowl cholera may follow the acute form of the disease. Result from infection with an organism of low virulence. Signs related to localized infections. Wattle form, wattles fiery red and hot to touch. Arthritic form, swollen limb joints and foot pads. Nervous form, torticollis. Respiratory form, yellow caseous exudate in air sacs. Postmortem lesions. Per acute, none or may have small hemorrhages on the surfaces. Acute, subserosal multiple petechial hemorrhages. Liver, swollen with multiple small focal areas of coagulative necrosis and heterophilic infiltration. Enterithes. Increased peritoneal and pericardial fluid. Free yolk, peritonitis, oophoritis, regressed follicles, chronic, localized inflammatory lesions. Ovary, yellow, putrid-smelling material, resembling cooked egg yolk, often surrounds the ovary and may fill the body cavity. Lungs, consolidation and having a number of nodules. Pneumonia is common in Turkey. Wattles, greatly swollen and indurated, first a cloudy gray fluid and later a cheesy material. Caseous arthritis, hock joint involve. Middle ear and conjunctival sac, caseous exudate. What is the diagnosis of fowl cholera? Isolation and identification. Material for bacterial isolation, acute cases, liver, heart, and blood. Chronic cases, bone marrow. Preferred culture media, dextrose starch agar, trypticase soy agar and broth. Does not grow on McConkey's agar. Smears, gram-negative bipolar rods in impression smear of liver or heart blood. Differential diagnosis of fowl cholera. Newcastle disease. Hemorrhages in proventriculus and intestine. IBH foci in liver. Infectious coryza. Facial swelling. Fowl typhoid. Pallor throughout cadaver and thin watery blood and bile stained enlarged liver. Control of fowl cholera. Pick up and destroy all dead birds before they can be cannibalized or fed on by scavengers. Biosecurity. Sanitation. All in all-out practice. Separate different species of birds. Fence off stagnant pools, drain rain puddles. Vaccination by bacterians and live vaccines. Vaccination of fowl cholera during an outbreak is seldom effective. Bacterians are not always effective. Make 2 injections, first between 8 to 12 weeks, about 1 month apart. Live culture vaccines are only used in healthy birds. Vaccinate chickens at 10 weeks and then at 18 to 20 weeks. Polyvalent vaccines are available. Vaccinate at 8 to 12 weeks age and revaccinate 6 to 12 months later. Presented by Dr. Muhammad Amir Sohail.